Scoliosis and uneven hips. What's really going on? Uneven hips are actually one of the most common physical signs of scoliosis. This happens because scoliosis doesn't just bend the spine sideways, it also shifts the trunk off center. To keep the body balanced, the pelvis often tilts. That's why one hip may look higher, more prominent, or carry more weight. But it's important to understand something. In many cases, the hips are reacting to the spine, not causing the problem. So treating the hips alone doesn't usually fix the underlying imbalance. Often, hip asymmetry is simply a sign of what the spine is doing. That said, hip imbalance isn't always caused by scoliosis alone. Sometimes we also see differences related to leg length. The first type is a functional leg length difference. This is very common with scoliosis and usually happens because the pelvis is tilted, not because one leg is actually shorter. When spinal alignment improves, this type of difference often improves too. The second possibility is a true leg length difference, where one leg bone is actually shorter. This can contribute to pelvic tilt and spinal compensation, but it needs to be carefully assessed, not assumed. That's why adding heel lifts or shoe inserts without a full assessment can sometimes make things worse. The spine, pelvis, and legs always need to be evaluated together. When we treat scoliosis-related hip imbalance, we focus on the whole system. Rehabilitation often includes exercises that improve pelvic control, core endurance, and balance between the two sides of the body. Scoliosis-specific rehabilitation programs like Scoliobalance help recenter the trunk, reduce uneven loading through the hips, and improve movement patterns. In some cases, bracing may also be recommended. Corrective braces can support the spine, reduce the trunk shift, and help improve overall alignment. When the spine is better supported, the hips often follow. A common mistake is treating the hips in isolation. Things like adding shoe lifts, only stretching the tight side, or ignoring visible pelvic changes can miss the bigger picture. Hip imbalance related to scoliosis needs a whole body approach. Uneven hips are a very common result of scoliosis. At Scolicare, we assess the spine, the pelvis, and the movement patterns together so that we can guide the right treatment approach. Because when spinal balance improves, hip balance often improves as well.